It's time to enhance the relationship between expertise and impact, between knowledge and application. Welcome to a journey of discovery and empowerment. Welcome to All Physicians Lead, the Forbes Books podcast that highlights the critical leadership role that all practicing physicians take on every day. Here's Dr. Leon Morse.
My guest this month is Dr. Jonathan Woodson, the 7th president of the Uniformed Services University of the Health Sciences in Bethesda, Maryland. In this role, Dr. Woodson oversees the university's academic and research mission across medicine, nursing, public health, and more, shaping the next generation of military, public health service, and Coast Guard health professionals. He previously served 6 years as the Assistant Secretary of Defense for Health Affairs and has logged numerous combat tours. Dr. Woodson is an academic vascular surgeon and has held professorships and leadership positions focused on clinical excellence and health policy, among others. A retired Major General, Dr. Woodson brings decades of medical, military, and policy experience to further USU's vital mission. Dr. Woodson, welcome to the podcast.
Well, thank you for having me.
It's very exciting, esteemed guest, and we all really appreciate you taking the time to share with us some of your wisdom and experiences. We'll start off with what's usually a fairly straightforward but often incredibly interesting question for the guests is, how did you get interested in the field of medicine and vascular surgery specifically?
Yeah, it wasn't something I visualized when I was a small child, but was very interested in science and biology, thought I was going to be actually a marine biologist. Came out of the era of the 60s, early 70s when, flipper was a big thing, and I thought I was going to run around cut off shorts studying marine life. But at any rate, I went to a career day in which they talked about medicine in medical school. And I said, I could probably do that. And actually, that's probably more exciting than running around the beach. And entered a 6-year BSND program. The rest is history. As it relates to the subspecialty I eventually went into, again, not a clear path. I started out actually in internal medicine, finished that, and then everyone told me, and I finally recognized that I acted more like a surgeon.
We'll get into that later. There's a
we'll
thread to pull on there. Yes.
And then went into surgery and then vascular surgery, because back in those days, vascular surgeons were able to operate a lot of different parts of the body and do rather large, complicated, and demanding operations. And that's always where I wanted to be. Wanted to be challenged.
Well, we appreciate it. The amazing things that you've done and advanced the science of medicine along the way. Also, not necessarily a divergent path, but very interesting to this particular audience is all of the leadership roles you've fulfilled along the way. And some of them are not typical for the academic surgeon track that we envision, chief, chairman, dean, things. Certainly the professorships have been there for you. But really big policy, healthcare, government leadership roles. What was the impetus for that, and how did you find yourself doing those service type roles?
It probably begins way back in medical school, where the program I was in really emphasized the intersection between health, medicine, and society, and the complicated nature of producing healthy populations really required broader thinking in terms of policy and support for what we now know to be the social determinants of health, but weren't spelled out specifically as such at that time. And so that was always in the back of my mind. And as I entered medicine, I practiced at an inner city hospital, complicated patients. As I practiced in the military, on and off of active duty, you recognize that making an impact required a broader aperture in terms of your roles and responsibilities. It's very true. You can make a tremendous impact one patient at a time. But when you think about important scaled changes that affect populations of patients, policy, and that the larger way of thinking was very, very important.
That breadth that you talk about takes learning and time and effort. Clinical care takes learning and time and effort. Many of our listeners are either getting into or plan to get into leadership roles. Balance is an overused term, probably, but what did you put in front of you? How did you take some of these enormous roles that you had and yet still continue to be proficient, invested in the clinical side of your professional career?
First of all, I think the listeners need to understand it's iterative. You don't wake up one day and say you're going to take on these roles. In fact, you have to develop a skill and mature your mindset about these issues. I think it was Churchill, and I'm going to really muff the paraphrasing of this saying, but he basically said that at some point in one's life, you may be called upon or tapped on the shoulder, as he said, to take on responsibilities that in which you can make enormous contributions. And it would be a shame if you weren't prepared at that moment to accept those responsibilities. So the issue is that way back when you really don't know where your career is going, it really is about taking on iterative responsibilities for leading change. In the course of my career, a lot of that work began as a health services researcher, then applying it to continuous process improvement, doing things within my hospital and hospital system, eventually becoming president of the medical and dental staff, particularly at a time when we were going through a merger, and that role was extraordinarily important. And through those iterative responsibilities, participating in committees, you learn about yourself, you learn about people, you learn about the art of the possible, and then how, in fact, to lead, which basically is about setting a vision for the future and influencing people to work toward common goals. So it's iterative. In regards to that, the Churchill kind of construct, one day I get a call in my office, and the call is from the White House. Originally, when I saw it on my phone at that time, I said, this must be a joke, if you will. But I called, and they asked if, that my name had come up to possibly be the Assistant Secretary of Defense for Health Affairs. And I said to myself, okay, I'll play along, not expecting anything.
I'm sure there's 700 people interviewing for this.
Yeah. Expecting, not much to come of it. But it turned out that they had gone through a series of interviews, and the candidates on the list were not quite right, but several of them whom I know said, you should call Woodson. And the issue was really that I had worked in the private sector. The military health system was undergoing some challenges, and I was very familiar with the military. And so I was kind of tapped on the shoulder, and it was really about the willingness, I think, to accept the leadership role and responsibilities, much to what Churchill was saying. Someday you're tapped on the shoulder, and you should be prepared to accept those responsibilities.
Well, I'll tell you from the perspective of one of the doctors in the trenches when you were in charge of that big segment of U.S. healthcare, it was visible, and we very much appreciated your leadership there. Many of us did. I'm sure you've heard that before. I did want to reach back, though. You said, somebody said to me I was acting more like a surgeon, so maybe I should be a surgeon. We've got some surgeons on the line. We undoubtedly have some pediatricians and some internists, and all of us would love to hear what that meant.
It probably is, how can I say, a little bit of a cliche, but it is about sort of decisiveness of decision-making, the willing to take on large challenges. I did internal medicine and loved it, but it's more contemplative. You have more time. In fact, to make decisions, you certainly spend more time consulting before making those therapeutic plans. But in surgery, particularly if you're in specialties like we are, and I did a lot of trauma. My practice, or particularly in those early days, you have to make decisions. You have to collect the facts, assimilate it, and move out on a plan of action because lives depend upon it. So I think that's what they were reflecting on. Others saw it in me before perhaps I saw it in myself.
It's the Top Gun quote, if you're not going Mach 2 with your hair on fire, you're not happy, from the original Top Gun movie. I remember that one well. The 4 kids in my medical school class that went into neurosurgery, to your point, were a former F-14 pilot, full contact mixed martial arts fighter, an airborne ranger neurosurgeon, and a kid out of West Point who was the same personality type. So we do sort ourselves out a bit. Hey, sir, you've had a long relationship with the Uniformed Services University, and many of our listeners know the nation's military and public health medical university. Maybe you and I don't want to add up the number of years, but it's quite a few. Tell us about that part of your journey and why you invested so much over such a long time, and even to this day, still doing it.
Yeah, no, that's a great question. And again, a set of experiences which I feel were very important. And it began way back when I was really a very young physician surgeon. I was in the reserves, the Army Reserve, and the Uniformed Services University sponsored postgraduate courses. And I was always looking to connect and, really get myself involved in the military medical community. And I would start coming to these postgraduate courses. Interesting things happened. I remember coming to the Society for Military Vascular Surgeons meeting, and back in that day, early on, this is 30 plus years ago, it was small and intimate. And I would be sitting at a table, and on my right would be Michael DeBakey, on my left Harry Schumacher.
The giants, yes.
Absolutely, giants in surgery. And they treated me with respect that I probably didn't deserve at that point, but, offering advice and asking me about what I wanted to do. And I really think that it was those encounters that really helped me develop my career path in vascular surgery. And of course, there was Norm Rich, an icon in surgery, vascular surgery, with his writings out of the Vietnam War, who really mentored so many surgeons. And so I just connected with that community. And so over the years, continued to be associated with it. Was an adjunct professor for many years. When I was the Assistant Secretary of Defense, of course, the university reported to me, and I was on the board, and I was on the board even after I left the position of Assistant Secretary, and then I was Chairman of the Board of Regents. So, I am honored to be part of this incredible organization that supports the national defense by supporting the military health system.
Well, we appreciate that. And I was certainly one of those young wannabe surgeons that Dr. Rich influenced and mentored. And the university is so much better for his leadership there for so many years. Some of our listeners might not be as familiar with the Uniformed Services University. It's not an advert here today, but tell us something about, from your perspective, why the Uniformed Services University exists, what are its strengths, why the mission and values are so important.
The university had its beginnings back in 1972 in the post-Vietnam era, when the legislature and the military recognized that it was going to be hard to recruit the physicians that were needed for service, even for supporting the military health system in peacetime. And so, through the support of senators, the university was established in 1972 as a medical school. And of course, it grew in stature, but fast forward to today, the university is made up of 4 schools and colleges, the School of Medicine, the Postgraduate School of Nursing, the College of Allied Health Sciences, and the Postgraduate Dental College. So we've become much more sophisticated, but add to that, also, we have 20 important research centers that support advancement in military medicine, particularly in those areas that are extraordinarily important to the military. We also have a research center, the Center for Global Health Engagement, which is really a premier research and developmental center that supports the combatant commanders in application of soft power, global health engagement, which has historically been underutilized or utilized effectively. So we're very proud of the efforts that the Center for Global Health Engagement has with the combatant commanders, or in support of the combatant commanders.
Yeah, it's quite a global reach. That's a impressive group of folks. From your lens, folks in the military, whether they're on active duty coming back to graduate programs at the Uniformed Services University or just starting out, there are a number of folks who come right out of college who take on some of the degree granting programs at your university. What are some of the unique challenges that you think military healthcare professionals face in their education and career, and what are some of the opportunities that are perhaps unique and worthwhile?
Yeah, Uniformed Services University is unique in the sense that we prepare superb clinicians, but we're also a leadership academy. We have to prepare military medical officers that have a broader understanding of their roles and responsibilities in engaging organizations and systems in complex environments and solving problems. They need to know how to build teams, work within teams, analyze situations. They need to learn how to lead up as well as lead sideways and lead down. And so just as the United States Military Academy at West Point or Annapolis or Colorado Springs consider important their role as being a formative platform for developing future strategic leaders, so USU is that platform for developing future strategic military and medical officers, which are so important to supporting the national defense strategy. So the challenge that the students take on when they come here are not only a rigorous medical curriculum, or in some of the graduate programs, behavioral health or public health sort of curriculum, but they take on the challenge of becoming leaders and understanding sort of the complex environment that they're going to go out into and how they're going to serve as really experts to support a wide variety of commanders around the world in a wide variety of situations.
It's interesting that you mentioned that. You have done that yourself, served multiple times in combat zones. Our motto at the university is, you well know, our unofficial motto is good medicine in bad places, right? And many of our listeners are familiar with that. So looking back on your deployments, what lessons did you learn? Challenges and opportunities there generated a lot of learning and a lot of changes in medicine that we've been able to move out to the civilian world, particularly in trauma care, but others as well, infectious disease. What were some of your experiences in those environments that can tell us a little bit about what that's like?
Well, leading military organizations, particularly in deployed situations, probably are some of the most complex and challenging leadership positions one can have. So think about it. you're deployed. You've got a mission, obviously, to support operations in the defense of this nation, to save lives of other servicemen and women who have committed to go in harm's way. And so that's a very trusted mission in which it's no fail, if you will. But beyond that, the issue is there really is the complexity of leading oneself in that environment, of leading others, of inspiring others to do their best when they are personally challenged and maybe even in danger. So it's not an easy leadership position. Beyond that, there's a lot of problem solving that needs to happen. I remember very well when I was called up in short notice to command a combat support hospital in Operation Iraqi Freedom 1. So this was the phase where we were leading up and crossing the berm through that initial effort to march to Baghdad. There were a lot of complexities of an immature theater that required decision-making, to include the fact that we didn't have sufficient medical forces, because the original plans had called for a northern front, and that had been shut down because of certain geopolitical concerns. And so a lot of the combat service support had to come through the southern route, yet all of it wasn't there and ready on day one of the war. So I was running, at that point, some operations all the way from the Horn of Africa to southern Iraq, even feeding resources into Afghanistan, because they had a very small medical footprint at that time. So I just throw that out because think about the complexity of that situation, about how do you advise commanders in terms of where to put resources, how do you inspire your people to do their best when the mission of the hospital is changing and becoming more complicated. How do you evaluate even the deficiencies of the hospital, make sure that you are shoring up those deficiencies so that you can meet mission? One of the interesting things that happened back in that time is early in 2000, I was in between military jobs, and I forced myself into the Air Force Critical Care Aeromedical Transport course. As I found out after the fact that I was the first Army officer ever to complete that course.
Wow.
But the issue was that fast forward when I was there in 2003, commanding the combat support hospital, I realized because of the shortfall of beds that we needed to keep our back door open, and talked with the commanding general at that time about bringing the critical care aeromedical transport teams in so that we could begin those evacuations as soon as patients were stabilized so that we could keep the hospital functioning. So this gets back to the issue about how one prepares themselves eventually for advanced leadership roles, which is you never know when you're going to get tapped on the shoulder to do what. And so young people have got to take advantage of different experiences to build that mindset and skill set, because it is really iterative in terms of development. It's never a one and done kind of course. I think it was the variety of those experiences that allowed me to function in the challenging situations in which I was eventually to be involved.
That's a great story. And I remember it painfully well, because even though our neurosurgical equipment packs and CT scanner were, 4A priority into theater, that's still behind the bombs and the bullets and the helicopters and the armored vehicles. Those come off the ships first. You only have so many ships and so many ports and so many cranes to unload all of this equipment. So, we're taking casualties, and like you said, trying to figure out how to manage them without what we're used to. You can't call the Codman rep or the Stryker rep and just have them bring stuff over from Georgetown anymore, right? It's just not there. So figuring that out. You talked about these experiences as you get into more senior leadership positions, and one of the things that I recall learning in the War College was the idea that as you get further up the chain, there are going to be many, many people who know you're leading a much broader group of professionals, administrators, finance folks, and combat. You're interfacing with the line, that you're not the person with all the answers anymore. And particularly as surgeons, we like to think, we know what's going on with our patient. We are decision makers. But when you move up, chances are most of the topics that you're talking about, decisions that you're going to be making, there's experts in the room that are smarter than you, and taking advantage of that really means not knowing the right answers, but asking the right questions. How does that concept fit into some of the things that you may have experienced as you were going way up the chain in leadership roles?
Well, as you go up sort of the chain, obviously the problems you're asked to address become more complex. And in today's world, the complexity means you have to bring together teams of eclectic individuals who have different skill sets, and ensure that they understand what kinds of questions need to be answered. But you've got to rely on those individuals to use their best skills to help create the menu of solutions. So it's not, in today's world, it's not directive from the top down. It really is about leading a process toward a set of answers for very complex questions or problems. And so the issue is that you've got to know how to work with people. You've got to know how to bring the best out of individuals. You've got to know how, in fact, to assemble the teams that you might need. As McChrystal says in his books, the reason the world is so complex today is because there are these multiple interdependencies. And you've got to be able to appreciate and understand these interdependencies. And then the truth of the matter is oftentimes there's never a perfect solution. You're really dealing with 70% solution. And so you've got to design a pathway so that you have what I call on and off ramps. You've got decision points. You collect data, and you've got decision points that allow you to course correct as you go along. You lead the team in creating this future state that clearly is better, and you want people to work toward. And then what you've got to do is develop the lines of effort to move toward that future state. But because the environment may be so volatile, uncertain, and complex, you have to ensure that you have pathways and points at which you can course correct, because you may have to reevaluate how you're doing things just because the world will change. The nature of the world right now is an accelerating pace of change.
Very true. Even the philosopher of war, Karl von Clausewitz, described friction, as we know, but the level of friction he was describing, I don't think comes close to what we see today. There's so much acceleration that merits further discussion, which we unfortunately cannot delve into right now. In the next installment of All Physicians Lead, retired Major General Jonathan Woodson will explain why all leaders need to identify their core values.
This is something that young people have got to iteratively reflect on, because your values are what act as your compass. There are a lot of murky situations that organizations and leaders can get into. And if you don't have a strong sense of your values to guide you in terms of what's right and wrong, you certainly will err. And there may be some difficulty. So you've got to iteratively reflect on and mature and develop a deeper sense of what your values, because that's what really is going to motivate you and ensure that you're on track to making the right decisions.
This has been All Physicians Lead. We can all be better leaders, and our teammates and patients will be the beneficiaries. Go to allphysicianslead.com to unlock your potential, sharpen your impact, and elevate your journey. All Physicians Lead with Dr. Leon Morse is a production of Forbes Books.